Welcome to episode 2 of The Pathway, brought to you by Pure Psychiatry of Michigan. My name is Taylor Hennrick, and this is my colleague, Sarang Patel.
Hey guys, how you guys doing?
Hey, welcome to episode 2, where today we're going to talk about what differentiates Pure Psychiatry of Michigan and what we're striving to achieve by treating those in the community. Let's dive in.
Let's get it.
So I think what we're diving into today, man, like coming back for episode 2, the idea that we're talking about today is what differentiates us, right? What makes us a little bit different than the rest? You know, is it how we feel? Is it what we do? Is it the team that we built, right? We go back to our championship team. What are some of the things that make us different in psych? Like in psych, not just in Michigan, but like what are we doing different than the competitor or the other people that are out there?
That's a big question, man.
I know it's loaded. I wanted to hit you right off the bat. I want to get you while you're ready to go.
There's no warm-ups anymore?
No warm-ups. Warm up.
Fine. Episode 2, no warm-ups.
Come on now.
I mean, we mentioned it the first time.
Okay.
We're different because of access.
Okay.
If
Accessibility.
you need to get in, you will get in ASAP. I
Okay.
mean, of course, therapy has wait lists because, counselors can only have a certain amount of caseload. You know that, right? You can't see 1,000 people as a counselor because you have an hour-long appointments, so on and so forth, right?
Sure.
And every prescriber is a little different too. You can have a big caseload, but theoretically, the idea behind Pure is that you can get it in fast for prescribing medication, for getting medications.
Guaranteed psychiatric evals within 7 days.
Yep.
Right. Counseling, we prioritize getting you in as soon as possible.
Right.
But due to availability, right, being able to get clients in within 7 days for counseling is very difficult.
Or insurance barriers.
Insurance barriers, right?
Above our pay grade.
Specific credentials for counselors being able to see certain insurances is a barrier for us.
Right.
Because we try to foster individuals from their limited license to full license.
Right.
That's one thing that we stake ourselves on, right? We're not just looking for the most highly credentialed individuals. Of course, we want highly credentialed individuals. But the goal is to be able to help that limited license, LMSW, LLPC, or LLC, be able to reach that full licensure and then to be able to serve a wider group of clients.
Right.
Right? So that's one thing that differentiates
That's
us.
your plug right there to say we're hiring all the time.
Always.
Always.
The door's open.
Yep.
Walk through it. Come join us on the pathway. Pure Psychiatry of Michigan.
Oh, man, dude. I shouldn't even talk. I'm just going to follow your path.
Hey, when I get to look over at your face, I am just a happy camper.
Oh, look at you, man. All about words.
He's getting a little bit red.
I'm a little blushing a little bit.
Man, what's different about us?
Yep.
I think the word that comes to mind for me is contemporary psychiatry. Okay? We're modernizing psychiatry, in my mind.
Okay.
What do you always talk about? What's a big factor for you? You're going to know.
Mm-hmm.
What's a big factor for you when you're looking at a clinician and you hope that they're using these types of medications? What kind of medications do you like?
All the brand names,
Boom.
baby.
New medications.
New
Why?
medications.
But explain your rationale. Tell me.
Because everyone wants to drive a Lamborghini
Okay.
and a 1920s car. Just kidding. Because you want something that's efficient.
Yeah.
You want something that's clean,
Yes.
right? From a whatever your side effect thing you're trying to avoid, sexual dysfunction, weight gain, sedation, whatever the issue may be, this obviously, etc. Right, keeps going on, right?
Mm-hmm.
But if we're going to give you medication, we hope that it has the least amount of side effects.
Yeah.
We know the medication works. Otherwise, the FDA ain't going to approve it.
That's true.
Like it's like just obviously going to be there, so you know efficacy is there. It's going to definitely work and make an impact in studies. But I think as you pick a medication for somebody, you hope that it's the cleanest option.
Absolutely.
Because the first medication we pick may not work. We hope that it works. And we tried everything we can do to make sure that it works, whatever it may be, right? But there's that risk factor that it may not work in anything in medicine, especially in psychiatry. So the goal is that, hey, if it does not work, okay, let's get to the next medication that could work, that we think could work. But let's make sure you don't have a bunch of side effects at the same time.
Right.
Right? Like, why do that? So you pick the medications you hope have the least amount of side effects.
Absolutely.
Generally, I feel, personally, right, this is me as a prescriber, I feel like the new medications are a lot cleaner than the old school meds.
Yeah.
But sometimes we need the old school meds.
Yeah.
It's all about, it's not a one-size-fits-all kind of thing, right?
Absolutely. What you're going after and what you're talking about is our first goal as clinicians in psychiatry and across all of medicine is do no harm, right? That's our first oath and our first goal.
Oh, that's the oath.
Do no harm, right? Our second goal is we want to provide you with a medication that's going to make a difference for you without consequence. And that's a difficult balance. These medications are known to have side effects. A lot of them have laundry lists of side effects.
Right.
And we want to use medications that are further synthesized,
Right.
that came to market for a reason because they're efficacious and they carry a higher standard, hopefully, than those other medications that have been there, right? We're not here to say branded medications are right for everybody.
Right.
We're saying, let's be the tip of the spear. Let's be a spearheading effort to use the best medications that are available.
Yeah.
Let's do what it takes to get our clients onto the newer medications sooner so they're not spinning their wheels.
Yeah.
Right?
As long as it's the right option, 100%.
That's contemporary medicine.
Oh, I like that.
Yeah.
Okay.
And then when I look at it on the counseling side, I look at our willingness, I hope that it's felt, our willingness to support counselors to get further training, right? Whether it be different modalities like DBT or EMDR or ACT, you name it. There's a bunch of different modalities out there. We are big on empowering counselors to be able to get those certifications, those trainings in hand so that they can offer that to clients.
Yeah.
To me, that's contemporary medicine.
We do that. Yeah, you're right. I forgot about that actually. That we want to invest in our therapists to get those trainings if they want them, right? Nothing's mandatory, nothing's forced. But if this is something you want to do, this is the place to do it.
Yeah.
Right? We've been at clinics before, jobs before, where like employers, wherever you're at, you're not really invested into, right? Like we want you to have the skills you want that can stick with you for the rest of your life.
Right.
And I always say, like, the goal is like, we want you to be here for 25 years, 30 years, retire here and say, man, I wish I started my career off at Pure, right?
Right.
That's the goal, right?
Yeah.
You want to have
Yeah.
a good environment from morale, from
Yeah.
quality of work to lifestyle, whatever it may be. Sure.
Yeah.
Right. But I think that, you can't always get there, but you try to give the best situations you can possible to get there for people, right? So
I always think about it as come grow with us, right?
yeah.
Hey, like we are in a growth phase. We're trying to expand. We're doing our best to be able to serve more people.
Right.
But come grow with us. Come get better. We're not perfect.
No.
The training wheels have come off. We've hit our own hurdles and our own barriers, and we've hopped over them, right? Former hurdler here. But we've been able to, we've been able to grow and learn from those bumps in the road to be able to be better down the line.
Yeah.
Right? This isn't a sales pitch.
No.
This is who we are.
Yeah. We're like Detroit Lions.
Truly.
Yep.
Truly.
Super Bowl next year.
Bite the kneecaps. I mean, we're all about it.
Okay. Yes, we are.
Dan Campbell apologists in the room.
Oh.
But if you look at what
just need a sun
differentiates
god.
us, I think so.
The sun god is here.
I think it's about empowerment. It's not enabling.
No.
It's us being able to say, let's do the right thing.
Yeah.
Let's do the right thing. And like you said, if a patient or a client walks out of the office and says, I'm a better version of myself, I feel ready, I'm going to go get after it, right? I'm going to try to improve myself. Isn't that us doing our job pretty well?
Yeah.
Okay.
But you also may walk out of the office that same day and say, that sucked. That was a really hard appointment. I don't really like that because you were challenged. Not every appointment you're going to walk around and feel like roses and daisies and feel like, oh, I feel like $1 million. It's
a
like,
great point.
No, you're supposed to have ups and downs. You're supposed to feel like you're being challenged, right? Theoretically, realistically, right?
You're absolutely right.
Right? You got to struggle to grow.
It gets worse before it gets better, right?
Yeah.
Old adage. Or maybe it's just you hit a struggle before you get to that point where you feel really good about things. Yeah. That's a really good point to bring up. Again, it's not all going to be in one line, right?
No. Nothing's linear.
It's going to be tough.
Most things in medicine are not linear. You hope
Yeah.
they could be, but you try to get there so you can. But it's not really linear, right? It's like a stock market, like a portfolio. You want it to have ebbs and flows. You want sustained, solid growth in the company. You want sustained, solid growth in your portfolio, and then you want it to increase over time.
Right.
So you'll have major ups and major downs where you're on these peaks and these cliffs, and you're just kind of up and down. You want to have stability if you can. I always tell people, right? Like, I want you to feel happy, sad, mad, glad, the whole 9 yards, but I just want to try to decrease the outliers because you can function in that area. We're not supposed to be like a machine,
Right.
Oh,
I love that you just said that.
Yeah.
I always tell my clients, I'd rather you experience some level of depression and anxiety than not experience any emotion at all. Right?
Yeah. Ain't no one trying to be numb out here.
No. We don't want anyone to be emotionally dull.
No.
We don't want them to be emotionless. We're not looking for robots. We're not looking for machines. We're looking for you to be able to control that and have that emotional regulation and then to be able to like put your best foot forward in day-to-day life.
Yeah.
I like that you brought that up. That's a really nice example.
Thanks, man. It's contemporary.
Yeah.
Hey.
I would come to you.
Oh, look at that.
Let me tell you.
I come to you too.
Yeah. I appreciate that.
You're welcome, man.
What else? What else differentiates us? Not for, again, it's not about competition, right? It's just more so like, what are we trying to build at Pure? What is an essence of a Pure mind, right? We talk about that.
The biggest hybrid model and the most accessible hybrid model. And when I say hybrid model, that means if you want to come in person, come in person.
We're there.
If you want to do telehealth, do telehealth.
Mm-hmm.
What do you want as a patient?
Mm-hmm.
I'm not the one here. Now, of course, as a clinician, if we feel like, hey, we got to see you to help you out, we may say, hey, I got to see you.
Mm-hmm.
That's what's medically necessary for you in our recommendation. Cool.
Mm-hmm.
I agree with that.
Mm-hmm.
But you as a patient should determine if you need to come in or if you want to do telehealth. I'm not trying to have you lose your job because you didn't have an appointment.
Right.
But I'm not trying to also inconvenience your lifestyle if you can't do it.
Right.
Like, you may not afford to be able to take a day off of work. I get it.
Mm-hmm.
So you as a patient, we are here to help you out in your capacity, whatever you need, in whatever aspect you want to come. Into the office, not into the office, you want to change it up. You want to change it up last minute. You want to change it up every month. Like, that's up to you. Mm-hmm. Unless we feel like we have to, like, obviously request that aspect, right?
Mm-hmm.
But that, I think, is like where, what separates it too.
Yeah.
It's not like they do this and we do that and they do this and we do that. No, I don't know what they do at all anyways. I don't worry about what they do.
Yeah.
But what we do is that we do what you want to do.
Yeah.
You want to come in? Come on in.
Yeah.
You want to do it with telehealth, audio, video? Come on in. Audio, video.
I think a way to say it is meeting the client where they're at. Meeting the client's needs in that moment.
Right.
Understanding that there are going to be limitations to what a client can and can't do. Clients work. Our younger clients attend school, academia. Our older clients may struggle with transportation. You never know what their needs might be, but we got to try to meet them where they're at. The other thing that I think about is, it's our goal to not feel as though we're just pushing people through, right?
Right.
Our goal is to be able to feel as though every appointment was an important one for the client. You may see a certain number of people in a day. We all have our individual schedules, but we have to customize. We are not a cookie cutter. We have to customize our care to be able to offer to that client what they need.
Yep. Judgment free, baby.
It's a judgment-free zone.
Get your cup of coffee.
Yeah. And come sit with us. Come enjoy your time.
Yep. Yeah. Coffee goes a long way.
It does.
A quality cup of coffee with cream, if you like cream.
Yes.
Or sugar.
Yes.
Or milk.
Yep.
Mm-hmm. Some like almond.
Okay.
Some like oat.
Mm.
But it goes a long way.
That's just you and I being coffee lovers and letting that fuel our lives.
I think it's comfort. When you come in, you got to be comfortable.
Mm-hmm.
Now, the first appointment is not usually comfortable.
Mm-hmm.
We get that.
Mm-hmm.
I tell them, hey, like, the first one's going to be hard. Maybe it goes great, sure.
Mm-hmm.
But it's supposed to be hard.
Mm-hmm.
And maybe the second one, maybe the third one.
Mm-hmm.
But give it some time. Let it kind of, go through the motions a little bit. See what we can kind of get to.
I want to offer one more differentiating factor. Obviously, there's going to be a few more, but one that's important to me is just giving a quick shout out to our front office staff. I mean, when our clients come to the office and are met with the smiles that some of our staff put on, even if they're not having the best day, they are able to make our clients feel so comfortable and so warm. That environment to me is something to be really proud of.
Yeah.
I love when we see a positive review speaking to the fact that so-and-so at this office just made my day or like helped me to feel good, even though I came in there in a bad mood. Holy cow. Talk about affecting change before they even have their appointment. I mean, that's a beautiful thing. And to me, it's an important thing to say. The staff that we have at each location work their tails off to be able to serve our clientele. Mm-hmm. Our office manager team is just a wonderful group of individuals. And even if you move into people behind the scenes, right? People working prior auths, people working on the billing side, or doing a lot of our training of some of the individuals within our companies, those individuals are really getting after it. I got to argue that that's a differentiating factor, man.
Oh, yeah. I mean, of course, your back end stuff is huge, right? I mean, we're not corporate. Mm-hmm. We're family owned. Mm-hmm. We don't have this huge backing with this massive organization in the background, right? Where finances are limited, where you can hire an IT company, hire this stuff, hire that stuff to help everything's smooth. So the team that we have, the office managers, office staff, your admin staff, your consultants that you have too, that we have on our team, right? They are what make Pure Pure. Mm-hmm. Without them, we'd be nothing.
Yeah. I think we have fair but tough expectations for the individuals that work with us.
100%.
It's from the top down and from the bottom up.
Yeah.
I mean, there's nobody within our company who's not pulling their weight.
Mm-hmm.
And I think that expectation doesn't follow people, but it pushes us to all be better. Like, it's like if you put a bunch of competitive people in a room, they're all going to want to be better.
Yeah.
Right?
Yeah.
And to be able to do more. I don't think there's any limitation to what any individual within our company wants to achieve and how they go about their day. It's so representative of what you and I want to do for the community.
I mean, you want to surround yourself with people, with like-minded people around you, right? Same goals, same drive, whatever it is.
Mm-hmm.
Those you want to meet at, those that you want to help support as well. But you want to surround yourself with people around, like you want to be with.
Mm-hmm.
They can help you grow as a person in society and whatever it may be. That's what you want to do.
And think about every time you're in the office, right?
Yeah.
You and I both being hybrid providers, we're in person some, we're telehealth other times. When you go into the office, how good do you feel?
It's fire.
I mean, it's a time. It's a great time.
Good time.
You're seeing smiles, you're hearing jokes, you're seeing people working efficiently, right? Getting after it when they need to. And there's such a nice balance between let's enjoy the day, let's like have a little bit of fun, but let's also make sure that we get everything done we need to.
Right.
In a busy environment, that's an important factor to have.
Yeah. That's true. I didn't think about it like that. I love going to the office though.
Yeah.
But even during COVID, we went to the office.
Right.
All the time.
I mean, we had to meet the needs of the people.
Yeah.
It boils down to that, right?
Yeah.
We didn't just hang it up and say, some people are sick, we can't do it.
Yeah.
Bro, I think we doubled down.
I think so.
To expand during pandemic. Other people are taking PPP handouts. Here we were growing, right? Here we were like not trying to capitalize on an opportunity. That's not it. It's more so saying we know people are in need. The need just doubled. And I think I'll go back to something that you said in episode 1. The silver lining of the pandemic is this massive light that was shined on mental health.
Yeah.
Like, hey, it's not just like, let's talk about it. Like, let's figure it out.
Let's do it.
Let's make sure that people can get the help they need. Primaries are doing the best they can. They're overwhelmed. We hear it all the time. Other psych practices are doing the best they can. They're overwhelmed. 3-month wait, 6-month wait. No, absolutely not. You need help? Let's get you in next week. Boom. That's what it's all about.
Yeah, I agree.
Right?
Yeah.
And it's not just being the fastest. Anybody can be fast. Anybody can be like, hey, let's get you in, and then that level of care is not there.
Right.
But we're going to get you in, and then we're also going to give you top-notch care.
Yeah.
That's what it's all about.
That's where we're at.
Man, that's an exciting thing to be able to share.
Yeah.
Right? That's something to be proud of. And that's every step of the way. That's our wonderful intake team. That's the front office staff. That's your office managers handling these clients that are coming in. That's people being able to help handle direct referrals. We have to show a lot of appreciation for all the individuals out there who do refer clients to us and that they entrust their care to us. That's a great feeling. Hey, I'm treating this individual, but I trust you to take care of their psychiatric needs or their counseling needs.
Right.
Man, we do not take that lightly.
No, we don't.
Right?
We don't. Yeah. I think that we're just getting started, right? A couple years old, not too long, right? We're just getting started. It's exciting to see where we're going to go. So obviously, we tell patients, hey, follow us on this pathway to kind of get better, obviously. But I'm excited for our pathway as well, right? To see where we go. But hopefully, the bigger we get, the more people we can help across the board, right? So this is just the start of the path. Kind of see where it takes us, see where we end up. And, people say, oh, what's your end all goal? What's your goal? How many locations, how many people do you want to serve? How many people do you want to help? There's no number. How do you put a number on how many people you want to help?
You can't.
You cannot. It's not the monetary number at the end of the day. It's the idea of, we're just doing this because this is part of life. This is what we want to do.
How can we predict that?
I don't know.
There's areas of need anywhere you look. Mental health isn't located in one location.
Yeah.
I think you and I have the luxury of being able to stop into varying offices and different settings within within medicine, the medical industry.
Right.
And you and I hear this, even in the primary care setting, I would proffer that 4 to 6 out of 10 appointments that a primary, whether it be an MD, DO, an NP, or PA is seeing, there's a mental health component to those appointments.
And 100%.
That's probably being conservative, no? 4 to 6 out of 10.
Yeah, I would think so.
You tell me 40 to 60% of your appointments have a mental health element. And then how many of those clients are actually seeing someone from psych? Small proportion, right?
2%.
Right. So there you go. So that speaks volumes to how much mental health treatment is being done.
Yeah.
In the primary care setting where there's a laundry list of medical issues and then mental health is buried on that list, why not send them our way? Let us be the primary for their mental health. Let us affect change. Let us focus on their mental health and then help them take those next steps so that the rest of their medical conditions can also improve, right? No barriers.
No barriers. Yeah, that's true. No barriers at all. Insurance, no matter what it is, location, demographic, age, no barriers.
Mm-hmm.
It's like the little ad that we have,
I think an argument could be made that we are going to remove barriers, right? We're going to do what we can to work within your means, whether it be, working within a financial hardship, working within a payment plan. It doesn't boil down to money for us. No. It boils down to like, what do we need to do to make sure that you can get the care you need to continue with so-and-so, to be able to attend your counseling on a biweekly basis? Like, what do you need us to do? We'll flex to be able to meet the needs of our clients.
Yeah.
I'm proud of that.
Yeah.
To me, that makes a big difference. Because if I had a family member in need, which we've all been there, pandemic or not, that needed to get in and they didn't have the financial means and they got turned away, how furious would you be?
Yeah.
I would be frustrated, man, especially with mental health. So for us to be able to say, we're going to do what it takes to try to get this client care. If they're willing to meet us halfway, we'll meet them halfway.
Yeah.
Man, I like that.
I mean, you're in a profession where a lot of times, adult patients, it takes you one stressor in life. The level of the stressor is different for everybody, right? Job loss, we talked about the first episode, job loss and relationship loss, whatever the situation may be. It takes you one stressor, right, to lose your insurance. To go from having a commercial insurance to now having no insurance. Or state insurance, which is totally fine. But how is it fair for us to be like, oh yeah, we take your commercial insurance. Oh, well, this is mental health. You had a life stressor, and now we don't take your insurance. Now you have to pay this, which no one can afford, and I can afford it myself, but we're going to charge it to you, and that's okay. That doesn't make any sense.
No.
So I don't get how mental health clinics, and maybe this is like the young people in ourselves talking here. I don't get how mental health clinics can say we only ask for cash pay. We only ask for commercial insurance. How do you not help everybody? How? I don't understand in psychiatry especially.
Right. I love that answer. That's such a real response.
Real.
It is. And it is because we all have individuals in our lives, whether special, whether acquaintance, whether family, who have varying levels of background, right?
Yeah.
And I just don't get how people can pick and choose who to help. If we pick the individuals with only one type of insurance, and if they don't have that, well, you got to self-pay. How many people are you going to help? What kind of practice is that?
No.
I don't think that's something I would be as proud of versus what we're doing.
Yeah.
And that's just taking the passion away from us. Like, you
can't do that.
No. We want to help as many people as possible.
Yeah.
No matter the cost, I don't know. When I look around in medicine, I don't feel like I hear a lot of people say that. I don't feel like I see a lot of people that are like, come one, come all, right?
Right.
I don't know.
That's your new motto. Come one, come all.
Come one, come all. I feel very proud to be able to say that you and I have built that in Michigan. 11 locations from the border of Ohio to the border of Canada and the thumb, right? And everywhere in between. We're in big cities, we're in small cities, and we're not done. So to be able to, I don't know, I guess look at that scope of what we're able to do, and like that many people that we can continue to get to.
Right.
Yeah, I like that.
I'm excited.
Yeah.
Excited to see where this goes. Excited to work harder.
Yes.
Right? We're not done.
No.
I'm not satisfied with what we've done yet, as you know.
This guy's a hard guy to satisfy.
I'm a hard guy to satisfy, yep.
Yeah.
My dad always says that you'll never be happy because you always want more.
Shout out to Sarang's dad. What a guy.
Yeah, what a guy.
Oh, you've built a good man here.
I think so. So far, so good.
Yeah.
Hopefully.
Yeah.
But I think this is the start of the pathway.
Mm-hmm.
The start of our journey. I'm excited to see kind of where we end up. Excited to see where our podcasts go.
Mm-hmm.
What we talk about next.
Oh,
who our special guests may be.
Right.
Maybe we get the big doc in here.
Maybe.
Yeah. Next episode, maybe.
Ooh, okay.
Still got to work on Big T to come in here, Big Tori.
Right.
But I think we'll get the big doc to come in here.
Yeah.
Try to get some good guests in here and see what we could do.
Yeah. Hey, and that wraps up episode 2 of The Pathway, brought to you by Pure Psychiatry of Michigan. I hope you join us next time for episode 3. We have a lot in store for you. Thanks for spending some time with us, and we'll see you soon.